Good morning, everyone. It's nice to be here. Next slide, please. Okay, so key data points in our county. So our cases are still ticking up. We're at 46.5 cases per 100,000 residents, almost 10% test positivity. And we continue to have a lot of reported lab tests per day. We've been this high for weeks now. So it sort of varies every few days, but still doing a lot of lab testing. We have actually, as of this morning, 124 hospitalized and 12 in the ICU. That number continues to tick up, and 34 deaths since April 1st. Next slide, please. And this just shows you that we have been sort of steadily on an upward trend since early April. Next slide, please. So here you can sort of compare the current wave to previous waves. So obviously the very tall one is our winter Omicron wave. The one before that is Delta. So we've been saying for a while that our case rates are higher than Delta. And the wave before that was the winter 2021 wave. And we are approaching the case rates there. And obviously the thing to think about is that, back in 2020, 2021, there was not home testing. So other than people who didn't get tested at all, like that was our case rate. During the Omicron wave, we estimated that for every lab test, there were probably, it was sort of a 1-to-4 ratio of lab tests versus home tests. And right now it could be as high as 1 to 8. Because you'll remember during the Omicron wave, we ran out, like it was hard to find home tests last winter. And now it's not. So we know that we are seriously undercounting the number of infections. Next slide, please. So again, this is just showing you our rise. It's too early to say that we're plateauing. We've been fooled before where we have a couple of days where it looks like it might be a plateau and then it continues to go up. So we sort of take that with a grain of salt when we start to see a taper like that. Next slide, please. So at the beginning of this wave, and we talked about this previously, we were really, and so I want to be clear, obviously in Alameda County, we have many more racial and ethnic groups than what's showing on the screen right now. These are sort of the 4 largest that we track. And at the beginning of this wave, we were really seeing the highest rates. You can see over on the right in the red, our Asian and white residents had the highest rates. And over time that has shifted. And most recently, our Hispanic and Latino residents are showing the highest case rates. And I want to note that some of the other groups that we track, like our Native American and Pacific Islander residents, are not on this slide, but their rates are actually higher, even than our Hispanic and Latino residents. We have more caveats when we interpret that data because we don't, it's a smaller number of residents and we don't have as good a sense of total population in the county. So the numbers are slightly harder to interpret, but we do know that the rates in those communities are also very high. Next slide, please. So you can see hospitalizations ticking up. They were pretty stable for a while, and recently they've started to increase faster. They've increased more than 100% since the start of May, and that was sort of one of the key data points that we used when reintroducing the mask mandate. And our ICUs have started ticking up also. We had pandemic lows there for a while with 1, 2, 3 people in the ICU. Today we're actually up to 12. So still low when you think of, if you see the yellow section there on the graph, you can see it's low compared to other waves, but we're looking at the trends very closely. Next slide, please. So wastewater monitoring, we have seen throughout this wave that it really aligns with what we're seeing in case rates. So it does look like it's starting to come down a bit. So this is through last week. But you can also see that there have been other points on the graph where it's looked like it's coming down and then it's gone back up again. So that's another area where we like to see more than 1 week of data going in a different direction to really declare it a trend in the right direction. Next slide, please. So as everyone knows, we did reinstitute our mask mandate last week, and the sort of big data points that we used to make that decision were the ones that we've been talking about for a while, which is increased hospitalizations and increased disparities in our populations that have been hardest hit since the beginning of the pandemic. And we saw that both of those were starting to show themselves, and made the decision to reinstitute masking. So it applies to all indoor public settings. You see a long list of exemptions there. Those are the same exemptions that existed in the past, except for strenuous exertion. Oh, can you go back? Thank you. Except for strenuous exertion. So in gyms, if someone's running on the treadmill, they can take their mask off. And then we exempted schools through the end of the year. About half of the schools had already finished their school year before we reintroduced the mandate, but we knew that it would be incredibly disruptive for schools to have to figure this out for a week or 10 days. But there is, the mandate will go into effect for summer school, summer camps, et cetera, after the end of the school year. Next slide, please. So the goals of the masking requirement, masking requirements aren't perfect because it covers indoor public settings. It doesn't cover, private gatherings, but, that's a huge, chunk of where transmission can take place, because it covers obviously transit, which has been, something that has concerned people for a while. We're hoping to bring about an earlier and lower peak of infections during this wave. We had a mask mandate during Omicron, and we still had a lot of cases. So it doesn't make everything go away. But if we can reduce the number of infections, peak earlier, provide increased protection for those at greatest risk, and reduce the number of our residents that end up in the hospital, those are good reasons to reinstitute a mandate.